Are you experiencing sharp pain in the front of the hip or the front of the thigh when you try to make a quick or sudden movement, or when you try to sprint? You may have sustained a hip flexor strain. In this video, we'll dive into what a hip flexor strain actually is. We'll also take a look at the anatomy that's involved, and I think it's very helpful in understanding the injury itself if you have a good idea of the working pieces. Following the anatomy, we'll go into common causes and symptoms that are experienced by individuals sustaining a hip flexor strain. Towards the end of the video, we're going to give you a behind-the-scenes look of what an evaluation may look like at Rehab to perform for somebody coming in for a hip flexor strain. Hip flexor injuries are a common orthopedic condition that affect many individuals at some point in their lifetime, especially if you live an active lifestyle or have more rigorous or just repetitive work and recreational tasks. A hip flexor strain is an injury to a specific group of muscles on the front side of the hip that assist in raising and lifting the leg. When these muscles get asked to do more than what they're capable of doing or just used to doing, they can become irritated. If the stress to this muscle is persistent or occurs with enough force, it can lead to a muscle strain. It's important to understand the causes and factors that will influence this injury to best determine what is right for you when determining a plan of care, who to contact, and what to expect. So let's start off by learning a little bit more about what a muscle strain actually is. A muscle strain is an injury to a muscle or a tendon. The tendon is the portion that connects the muscle to the bone. Injury occurs when there is excessive stress placed on the tissue with a given activity and can even result in a tear or structural damage to the muscle. Strains can range in severity from being just mildly irritable to significantly painful and even functionally limiting. We classify the severity using a grading system, ranked 1 through 3. 1 being the least severe and 3 being the most severe. Grade 1 is often characterized by having minimal muscular damage, minimal or no swelling or bruising, mild symptoms, and only slight limitations in functional status. Grade 2 involves tearing to the muscle fibers, but not complete disruption of the tissue. Bruising, swelling, and pain are often more present and significant with Grade 2 in comparison to Grade 1, and this will be reflected with more limitations in the ability to utilize the leg comfortably and effectively. Grade 3 strains involve a complete tear of the tissue, resulting in a more significant symptom profile with regards to pain, bruising, swelling, and significant difficulty or even inability to lift their leg or perform activities of daily living. The severity of the strain will dictate your plan of care and expectations with treatment options and timeframes. Grade 3 strains may require surgery to correct, while Grade 1 and 2 can be treated successfully with more conservative means. When we talk about the hip flexors, we're referring to a group of muscles all involved with playing a role in flexing the hip, or otherwise lifting the leg up. Now, there are a number of muscles involved with this motion, but the primary muscles are the iliopsoas, made up of the iliacus and psoas major and minor muscles, and also rectus femoris, which is one of the 4 quadricep muscles. The iliopsoas are the primary hip flexor muscles originating in our lumbar and pelvic region and connecting to the front of the hip near the groin at a bony prominence called the lesser trochanter. The rectus femoris is part of the quadricep muscles, so it not only flexes the hip, but also extends the knee. The pectineus and sartorius muscles also play a small role in hip flexion. However, when we discuss hip flexor strains, they're most commonly referring to the iliopsoas and the rectus femoris muscles. There are a variety of ways to injure your hip flexor muscles, but they're most commonly injured with repetitive or forceful tasks. Typically, they'll occur with movements such as running, jumping, kicking, changing direction on a field of play, or having your leg forcefully or unexpectedly moved into an extreme position, most often behind you. When the injury occurs, it's often accompanied by pain, weakness, bruising, and swelling, consistent with the grade or severity of injury you're experiencing. Many individuals will also report a pain on the front of the hip, towards their groin, or into their lower abdominal area. A sensation of tightness or pulling in that region is also common, as is weakness or fear with lifting the leg, walking and picking up the leg to go up stairs or hills, Running, jumping, and higher level athletic movements and repetitive movements are often even more challenging to perform. So what should you expect at your first session in your evaluation at physical therapy? It may vary a little bit dependent on person to person and case by case, but you're going to see some common themes amongst all the evaluations. After they get a detailed history, figuring out how the injury started, how you're currently feeling, what has led up to today, they're going to go into what they'll call the objective part of the exam. And really the purpose of the objective part of the exam is so that they can look at your range of motion, your strength, your overall movement patterns, and figure out what are you currently capable of doing and what are you currently capable of tolerating. This will allow us to then best figure out what do we need to allocate efforts towards from an intervention and a plan of care standpoint, and also how aggressive or conservative do we need to be, and at what rate can we progress moving on into the future. With the evaluation, typically they'll have you do some movements from a standing position. So they'll take what they call a top-down approach, and they're going to have a general idea of how do we move as a total body and as a total unit. After that, they'll make their way onto the table and they'll start to get a little bit more detail oriented and start to get a little bit more tunnel vision towards that hip flexor injury. This is when they're going to try to isolate the hip joint and the surrounding muscles and figure out what does mobility, strength, and stability look like around this area. Following the table examination, don't be surprised if they take you back up onto your feet, onto the turf or into the gym area, and they may ask you to do some things that are specific to activities you encounter as part of your daily living, part of your work or occupational demands, or different leisure, recreational, or athletic activities to best project when you're going to be ready to safely and confidently return to sport, work, or just daily activities in the future. What should you expect as part of your plan of care and treatment when you come to physical therapy? Now with this, there's going to be some variance from individual to individual, but you will commonly notice that amongst all cases, there's going to be a degree of symptom management, which may come in the form in just education on what activities are appropriate or inappropriate for you to do. They may give you guidance in regards to referring to what your physician has recommended with medications or any pharmacological intervention, and they may go over different modalities such as icing, heating, or general soft tissue or self-myofascial release that you can do to help calm that area down and make it a little bit more comfortable. Following that, mobility, strength, and functional movement play a very large role in what makes up the bulk of your PT plan of care. From a mobility standpoint, you will get a global stretching program geared not only for the lower body, but also for the low back and core area, as those muscles work hand in hand with hip flexor strains. When you're going through mobility, expect a lot of stretch to be felt and experienced through the front side of the body. And when I say felt and experienced, that's what we're trying to target that area. So not necessarily the intensity of the stretch, but it'll seem like the stretches that they're picking for you are going to tend to lend themselves to be more towards the front side of the thigh and the front side of the hip. The quadricep muscles and the lower abdominal muscles and even the muscles on the inner thigh or the adductor muscles are all muscles that help complement the hip flexor, and they will be a primary focus in addition to the hip flexor muscle group in itself. From a strengthening standpoint, hip flexor strains can be irritable to try to do a lot of activity early on with, so you may have your PT recommend to do isometrics. And isometric is simply a way to contract the muscle, but without going through a full range of motion. So you'll typically be put into a position and they'll ask you to either hold that position for a length of time, or they may ask you to meet a given set of resistance, whether it's manually, with a resistance band, or with a light weight, either a free weight or through the use of machine. These isometrics serve as a great way to reduce symptoms, to build strength, and also to prepare that area for future strength exercises that look more like your traditional strength training means. As you transition out of that isometric focus, you will find yourself starting to do activities that look more and more like just traditional weight training. You may be doing squatting patterns, you may be doing lunging or hinging patterns, you'll start to do things that commonly look like part of your previous or future workout routine, and they'll be scaled back with regards to the amount that you're doing, with the weight that you're moving, or the sets and repetition, or what they may refer to as the overall volume of the activity. As you get more comfortable and more tolerant, all of those parameters will start to increase until you're back doing what your normal workout routine was prior to the injury. Now, strength training plays a very large role in our ability to tolerate impact activities. So if we want to be able to do things like run and jump and a lot of other open field or open court athletic movements, we need to have a baseline level of mobility and strength. So after we've gone through symptom management, we've regained our mobility and flexibility, we've gotten back our strength training routine, this is when we commonly start to reintroduce some of our low impact activities. You may find yourself doing different hopping or bounding activities. Skipping and light jogging are also good ways to get back into the mix and what you were previously doing. And eventually you'll be back mimicking all of the same demands of your work or your sporting activity in a controlled environment in the clinic. And as you demonstrate the ability to do that safely, you'll be given a home exercise program that allows you start to return to run and return to your sport activities in a gradual and safe manner. When you discontinue physical therapy is going to be different for every individual. And a lot of that's going to be dependent on the symptoms that you are still or are no longer experiencing, and also what types of activities you're attempting to return back to. The more complex and the more intense of the activity that we're trying to return to, the longer of your duration of PT you may expect. If you're going back to a more controlled or potentially sedentary lifestyle, your overall duration of physical therapy and the plan of care associated may be on the shorter end. In general, it's common for these injuries to last anywhere from 4 to 12 weeks, and that wide variety of time range falls deeply into how intense and how severe was the injury you encountered, and what are the types of activity that you're trying to return to in the future. At some point during your life, either you or somebody you know will have probably come to you and talked about a nagging pain in the front of their hip that they first started to experience when they were running or when they were jumping, or just when they simply had to make a sudden movement that they weren't expected for. Hip flexor strains can be commonly treated with conservative measures, and most of them do return to full level of function with appropriate time and plan of care. Make sure to stay tuned for next month when we dive into low back pain, how to diagnose it, how to manage it, and what to expect at your physical therapy session.